welcome to On Becoming a Healer. I'm Saul Weiner. This is part 2 of a 2-episode interview with Dr. John Scala. In episode 1, we learned about his extensive experience in solo practice, and in this session, we hear about his experience specifically during the COVID pandemic. I pick up at the point where I asked him about what it's been like. So tell me a little bit about when you first heard about COVID and when it first started to come into your practice and affect you and your community.
And if you remember how it started, it was approximately January 20th, and the Chinese president, he said, we have this new viral pneumonia. And then the very next day, the leader of Russia, Putin, he shuts the border. And then 5 days after that, Trump says, or maybe it was a week after that, Trump says, okay, no more people from China on airplanes. Okay, and that all happened within a course of a week. I'm like, because you know what happened? The three of them probably talked 2 weeks prior to that, and Xi said, I'm going to do this, and then Putin already had his decision made, and so did Trump. So that's how I knew it was a big deal. So I went on my medical website, and I ordered gowns and gloves and masks. And usually when you order these things, it's in stock. It says in stock, ready to ship, and they just bring it on a truck over to my office. So I ordered like 500 masks and 200 gowns and a bunch of gloves. So initially it says on the computer site, it says in stock, ready to order or ready to ship. And then it doesn't come in a couple of days, which it usually does. So I go back on there and it says back ordered. And still I'm waiting for it. Finally, I go another week later, order canceled. So this was by like the first week of February. So then I knew that this was a major problem. This was going to be a big deal because what was going on is there was a medical freeze at the supply place, and the government was buying up all the stuff. So that's kind of how the whole thing started. And so I did all my personal preparations at that time, stocking up on food and getting everything ready at home. And I read as much as I could on a daily basis to figure out how we were going to proceed through the coming pandemic. Fortunately, I had a family that actually is from Wuhan. And so they were kind enough that I could call every week and they would give me updates of what was going on there throughout February. What
do you mean you say you had a family from Wuhan? Tell me about that.
Yeah, so I take care of the baby. So it's a young couple. And so the father, his auntie worked in the main Wuhan hospital because that's part of the country they were from. But I was able to get basically a secondhand explanation on a week-by-week basis of the challenges going on in Wuhan. And, of course, it was like 10 or 100 times worse than what was being released.
And when did you realize that this was going to come to your neighborhood, and probably in a serious way?
As soon as Xi announced and Putin shut the border and Trump stopped the flights, I knew it was going to be a worldwide problem.
And this was about when?
That was in January.
Wow. And when was the first time that somebody you knew or who you cared for tested positive?
So that happened at the beginning of March, and that was before things had locked down. And so people were still going out, and I had one couple, and they're an elderly couple, and the guy stays at home. And then the woman, she goes out and does the errands, and they go to church every morning at like 6 a.m. So she ends up getting sick with fever and cough and ends up in the hospital. And, at the beginning of March, the testing wasn't that good, but she tested positive. And then her husband, who generally stays at home because he's very elderly, he turns out with fever and cough at home also. And so, obviously I couldn't visit either of them. And I was talking to the children who was staying with the father. And I guess we got hospice in there. I can't remember the details. And so they ended up dying a day apart from each other. One died in the hospital, and the next day the guy died at home. So they're both COVID cases. He wasn't counted because obviously he never left the house. It was just obvious if she had it, then he must have had it also because it was the same illness.
And they had been patients of yours for some time?
Right, 7 or 8 years. They were a wonderful, wonderful couple that I took care of on a regular basis, and they were both gone within 24 hours.
And did you know other members of the family?
I just knew them through the phone because, the woman was a very, spunky and energetic 80-year-old. She could have passed for 60, let me tell you. And so she was driving and she was doing groceries and housework and doing all this stuff. So I really never got to meet the rest of the family because the lady in the marriage, she took care of everything. I'd even see him at church occasionally.
So what was it like for you to lose these two patients so early in the pandemic who you had known for so long?
It was it was sad, but in a certain way, because they both left within 24 hours. So it would have been worse if one of them was sick and then the other one was alone.
Mm-hmm.
One of them died and the other one was alone. So as tragic as it is, I think looking at it from the intensity and closeness of their own relationship, they were always together. So for her to be in the hospital isolated with him being at home, as sad as it is that they both died, that, it's kind of good for both of them.
Yeah, and that neither had to grieve extensively for the other.
Right.
And what was going through your own head as a physician, preparing emotionally and practically for a pandemic when you would be putting yourself at risk and potentially on the front line?
One of my workers got sick. I swabbed her and she was positive. It was March 19th. So she ended up being out of work a week. She actually spent some time in the hospital and stuff. And so, seeing a young person like that get so sick, like, all right, this is pretty serious. So I had to make some decisions over the next couple of weeks, the last 2 weeks of March, as the country was shutting down, how I was going to proceed. And I thought about it a long time, and I talked to my wife, and I actually talked to my kids too. And, the thought is we don't know what's going on here. We don't know how serious it is. I'm over 50. I have high blood pressure. I could be in the risk factor profile. But on the other hand, this is what I train for. I mean, doctors are here for helping people during a health emergency. And I've done a lot of medical history reading over the years. So, even during the pandemic of 1918, the doctors all worked. Some of them got sick. Some of them died. So I thought this was my time, and my time to help as much as I could, with the knowledge that there's some risk that I could be sick or end up in the ICU or even die. And so that's kind of a challenging thing, I think, in your middle years when so many things are going to think about it that way. And so I thought about it a long time, and finally I said, all right, if this is my path in life, then I'm going to go at this time, but I'm going to keep doing my job to the best of my ability, even with that risk, as safe as I can. And at the time, it wasn't very safe because we didn't have anything. So I did the preparation, which was visiting my estate lawyer, making sure everything was in order, giving my wife a list of all the phone numbers of all the contacts, and doing the religious stuff. I'm Catholic, so I set up, the church was closed and everything was closed. So the pastor, he gave me a confession privately at the church. And the thought on that is if I end up in the ICU, then the priest wouldn't have to be exposed coming to the hospital. So that was kind of my preparation. But once I made the decision, it actually was kind of relieving. Like, all right, I'm going to take the risk for my own health and be there for this whole time for my patients. And that's what I did.
And what kind of shortages did you have with PPE at that time?
Well, I mentioned I ordered all that stuff from the medical supply, and none of it came. So at the time, I only had 2 boxes of surgical masks and gloves. So like when my assistant got sick and I swabbed her, she was coughing and out of breath, and I swabbed her with a simple surgical mask and gloves. And for most of the month of March and most of the month of April, that's kind of how it was. After things shut down and when things were more severe in April, some of the people that were suspected of COVID or my assistant, I would go to their house. And by then, there was one of my patients, he's Chinese American, and his buddy had smuggled a box of these full Tyvek gown suits onto one of the container ships. So he got those from the Los Angeles port for me. And they were expensive. Usually they're like $5 each. I think they were $25 or $30 each. So I got 4 of them. And so I would just rotate them out. And so I'd wear the Tyvek gown and I got a mask with a face shield and a little beanie hat and my gloves. And I'd go to the patient's house and check them because at the time we didn't know how contagious, and I didn't want them coming in my office and being out in the community, you see.
So at this time, you still didn't have N95 masks?
No. But throughout April, there were some people that would bring like 2 or 3 because I had them in like their workshop in their garage. So I had a couple here and a couple there. So I got to wear those occasionally, but then we would leave them, like on the dashboard of the car because the sun and the heat would sterilize them, was my thought.
And then what happened? At some point, you ended up getting more N95 masks, or how did that play out?
Right. So the American College of Physicians secured for their members masks and these kind of plastic blue gowns. And They're pretty expensive. Obviously, there's a shortage. So I was able to get, I think I've got like 100 or 120 N95s now, and I have some plastic gowns for my staff. So I do have those, but I'm really just using a surgical mask now because no one can understand you when you're in the N95. If you have it fitted properly and it's tight on your face, anyone over 65, they can't understand what you're saying.
So if you're caring for a patient who is COVID positive, what do you do with an N95 mask?
Right, that's a great question. So, initially I would do my whole bunny suit workup and all that, but because of the volume that we see here after the shutdown later in the year, I would just wear the mask and a face mask, like a surgical mask and gloves, and I just swab them like that. So I swab them, I have them keep their mask over their mouth, and I give them a Kleenex, and so I can stick it in their nose while their mouth is covered still, so that way if they cough, it goes into the mask. See, it makes it safer that way. And if they turn out to be positive or if I have a high suspicion because they had a contact, I give them the mask. See? So I decided that I've been exposed enough already that I'm just going to keep wearing the surgical mask. And then I'm going to save the N95s for people that I suspect are positive so that they don't infect other people either leaving the office or in their community.
So you're asking them to wear that N95 as long as they're positive? What do you tell them?
Right. Well, at least wear it until they get out of our building. And then these are really high quality ones, so they'll easily last a couple weeks. So I ask them to wear it whenever they're outside of their house. They should be quarantining if they're sick, obviously, but practical things sometimes intervene with that.
So it's quite remarkable that you've got these precious N95 masks that you paid for from the American College of Physicians, and instead of wearing them yourself, you're giving them to your patients so that your patients don't spread COVID in the community.
Well, yeah, I thought that was a logical thing to do.
And you're still just wearing a surgical mask with a face shield?
No, I wear glass. I just have my glasses now. I went to the hardware store and got a bunch of safety goggles. So sometimes if someone's a really high risk, I'll put those on over my glasses. But the face shield, it's really hard to see through it. So I'm not doing that anymore.
And how has all of this equipment affected the doctor-patient relationship? And how have you made decisions about how to relate to patients given the changes brought on by the COVID pandemic?
Right. So, that's a really interesting question, and it's kind of evolved. So if you remember in March and April, people were pretty fearful and we didn't know how the course of things would work and we didn't know enough about it. And looking back, I'm almost thinking that the national shutdown was to help the doctors like you and me to be educated about the nature of the disease, more so than even flattening the curve. So in April, our volume in the office was about 25%, and the majority of those were children less than 2 years of age. So I decided early on that I wasn't going to skip any childhood vaccinations, despite the risk of coming out in the community. Children over 2 years of age, we gave them a 2-month break so they could come a little later. But I wanted to make sure that we didn't have any secondary measles outbreaks or any other issue going on. And so then May turned out, and we did some telehealth visits for April. Telehealth is pretty inadequate for most situations, unless you're just talking. And so then in May, it was up to 50%. By the end of May, Colorado had a mask mandate. And so by June, I was starting to see the situation where I was thinking about the patient relationship and all the fear out there, and I thought that maybe we're losing something with all the PPE between primary care and the patient. And so depending on the risk situation of the patient, and I know there's a lot of asymptomatic illness, I start giving patients, especially children and their moms when they're coming for well visits, the option of removing the mask during the visit. And some other people, I gave them that option also, and I would continue to wear my mask. And I was a little hesitant to do that, but by then I had the high efficiency HEPA filters, the medical grade ones to clean the air and so on. And actually it turned out to be kind of a neat thing because everyone was so relieved that they could finally act normal just for a few minutes in a safe location in front of a person that wasn't necessarily their family. And so that's kind of how we proceeded that.
And what about touching patients and the exam and how that's played out for you during the pandemic with all of the precautions people are taking?
So I always examine the patient. There's been a few people coming in, mask, face mask, gloves, that actually ask me not to examine them. And of course, I comply with that. But part of the physician relationship is most people want to be touched. And I think it's even more acute right now in terms of that. So, I'll wash my hands and then, I'll examine people. But they were doing all this like elbow bumps and fist bumps. And finally, about 2 months ago, I'm like, all right. I'm like, we're going to do things like we used to, but in a little safer fashion. So now when I walk in the room, I used to in the old days, I walk in, say hello, shake their hand, ask how they're doing and so on. So I decided that I'd try doing that again and see how the response was. So I think it was in August I started, and I walk in and say, hey, how you doing? I'll say, can I shake your hand? And some people have a little quizzical look, but most people just shove their hand out there, shake their hand. Immediately after I shake their hand, squirt it with the sanitizer. Okay. And I know it sounds like this simple kind of thing and stuff, but it's actually a big thing because it's kind of a standard greeting in our current society. Obviously in the Asian countries they bow, but here we do that touch, we shake the hand. So now almost everyone wants that, and we do it safely by each sanitizing afterwards. So that was kind of a neat thing, I think, to see. There was a business guy, and I shook his hand, and he kind of held it for an extra second. He's like, thank you. He's like, that's the first handshake I've had in 5 months.
Wow.
5 months, right? So I thought about a lot, and just the pandemic in general has kind of caused the medical profession to maybe put a barrier between the patient. We're almost losing a touch of the humanity by making it about the barrier for the illness rather than the patient.
Do you think that requires putting yourself at greater risk?
That does. I believe it does, and possibly my staff and so on. I've done a lot of the precautions here. We had trouble with the sanitizer wipes, so you can't get those anywhere. It's like $100 for 100 of them at the medical supply because they're in such short supply. So what I did is I went to the restaurant supply place and they have this sanitizer and it kills all the bacteria. It's a concentrate. And so then I bought a bunch of spray bottles, and the bottle of the sanitizer, it's like $4. So an 8-ounce spray bottle, you put 5 milliliters or whatever it is in there and you dilute it with water and you just spray it everywhere and then you wipe it down with a paper towel. So that's a really cost effective. So we're wiping everything down, plus the medical grade HEPA filters that filter down to 0.1 micron. We make it as safe as possible, but we also try and keep the kind of the personal side of it, the humanity, because people are so isolated. And we saw that in April. Once April passed, I realized, because there had been a ton of phone calls and very few visits, how fearful and how isolated people were in their homes during the shutdown. Right?
Yeah.
They're all at home. They don't want to come here. They don't want to go out to the grocery. They don't want to see anyone. I said, we can't keep doing this. This is going to be a secondary, even more major problem.
Mm-hmm.
So that's when I realized that I thought it would be important to have a safe environment here, but where people are always welcome. And that's what we've worked for this year. And I think it's working. I think people really appreciate that they can come, they can talk to me about COVID, they can talk to me face to face, they can feel safe and really have their time.
And what did you say to your staff in terms of they're making decisions about? Because it sounds like you stayed open much more throughout the pandemic than other practices and with much more direct engagement with patients. So tell me a little bit about how you communicated about that with your staff.
So we stayed open every day. And so with the staff, I gave them the option whether or not they wanted to come in because the volume was way down. So I could theoretically have been here myself and probably managed okay. And so the one lady, she had COVID and I'd been visiting her at home. So she was out for basically the entire month of April until she was well enough to come back. And then the other two, I simply gave them the option. And what they wanted to do is alternate their days. They wanted at least one person here with me each day. So we kind of alternated it. And the other days were paid, of course. The national law was if there was a national shutdown, you have to pay your employees even though they're not working. So that wasn't an issue because I had lots of equity saved up. So they alternated their days and they came in and it wasn't too busy and they wore their masks and we only had masks and gloves at the time. And we saw the well babies and we gave all the regular vaccines. By the end of April, they both said, all three of them said to me, they're like, we want to go back to the full schedule. We want to be part of this. We're not afraid. We have it down. We understand and we want to help you and work here in the office. And so that's what we did. By May, we just went back to the full schedule.
Now, you received, you mentioned, I know there was the CARES program. I know there were a couple of revenue streams coming from the government to practices. Can you tell me a little bit about that and how that affected your practice?
Right. So some things ended up in my account. So the way Medicare pays is they pay direct deposit into your bank account. So there were two payments from HHS, that's Health and Human Services, and that totaled for me $11,000, and they just appeared one day in my bank account. Then the other thing was something called the Paycheck Protection Program, the PPP, and that was basically if you keep your employees, on the payroll, even though they're home for COVID or your business is not doing well, then the government will give you like 2.5 months worth of rent and payroll costs, et cetera, et cetera. It's a loan that would be forgiven if you meet certain standards. Okay. So I went through the paperwork. I wasn't sure how it was going to go. I wasn't sure about how long the shutdown would be, how the volume would be. And so I applied for that, and I think I was eligible for $44,000. And I decided to take a smaller amount because I had other money saved up, and I thought more people needed it. So I borrowed $37,000. And, it was ripe for fraud because I filled out the stuff online through the bank, and like a day later, the money's in my account. Like someone really checked that, right? I'm like, all right. So anyway, then May turns out to be, 50% volume, and June is like 75 or 80%. July, August, and last month, we're like 100% again almost. So I know it's a forgivable loan, but I had saved a lot of equity because I pay myself lower. So last week I ended up paying it all back because I really didn't need it. It could have been forgiven, but I've never really taken a handout like that from the government. And I just felt a little unethical doing that.
So in other words, you had met the criteria to keep that money, but you decided to give it back to the government because you felt like you didn't need it.
Right. I had saved my money by paying myself less, so I had a lot of equity in the company. So once I realized that the volume was coming back to where it should be, and you think, well, 37,000 out of 3 trillion doesn't matter, but maybe a little bit matters. So I didn't want it on the books anymore, and I just wanted to stay like completely independent of that situation. They could have some leverage on me in the future, so I sent it all back.
Now, you say you had to you reduced your salary. During what months did you have to do that? For how long?
Just April and May.
Was it a significant cut that you gave yourself?
Right. I wasn't sure how it was going to go, so I reduced by 40% for 3 pay periods, which was about 6 weeks.
And you kept your staff at full pay?
Absolutely. They're great.
Yeah. Mm-hmm. Yeah. Now, with the pandemic possibly heating up and the need for physicians to step up, particularly if there's a surge, what are your thoughts about that? For instance, if they need you?
Oh, I already volunteered for that. So there's in the Denver area, it's what we call South Denver. It's like all the southern suburbs south of Denver. So the South Denver area is where we're at. I'm in Centennial. And so the previous healthcare organization that I had worked with, I still have privileges with their hospital for newborns, of course. And so back in March, they put a call out to all the independent or employed physicians that work in offices. They put a call out and say, we need a set of docs that are on semi-emergent call for a surge at the hospital. And there's probably a couple hundred of us, be either employed or a couple remaining independents like myself. So out of that big group, there were 6 of us that thought we still had the experience to do that, or were of the age where we wouldn't mind being exposed. So at the time, I started restudying ACLS, and I started reading all the technical reports from like New England Journal and so on to see what kind of the treatment protocols were. Started relearning about prone ventilation and all the cool ICU stuff. And so I really started updating my knowledge. And as it turned out, we weren't needed at that time, but still we're on call for the possible November-December surge, which according to projections could be significant.
Was it unusual for a primary care physician in your area or other physicians to sign up to participate in the surge? Because you're obviously exposing yourself to additional risk.
Yeah, I think knowing how many outpatient primary care there is, even though they're employed by big organizations, in my previous employer, of course. I was surprised there was only 6, but there was a lot of fear at the time, and maybe now, knowing that maybe there's a second surge, there might be more. But I have the experience, Saul. I did ICU and inpatient for 10 years, all kind of on my own. And so I just need a little refresher. Plus, I just studied all the critical care for the boards the following year. So I thought I was more than adequately prepared for that. And, honestly, we're all going to be exposed. I mean, unless you're willing to live as a hermit, we're going to be exposed.
Mm-hmm. How did you communicate with your family, your kids? You've got 2 daughters and your wife, about the risks that you were going to take, both in your own practice, keeping open throughout the pandemic every day, and then also the possibility of going somewhere when there's a surge. As you said, you're in your 50s. How did you communicate with your family and your kids about that? Assuming you did, if you did.
Of course. Well, first thing, obviously I asked my wife, because I'm the major, I'm the main person that brings the money in for the house. She works part-time. And, she said, well, of course you have to do this. You're experienced enough. It was like there wasn't even a question about it with her, because we both knew the risk. And, I had explained to her about the church and the estate lawyer and all the phone numbers, and we went through all that. And it was right around the time of my birthday in April. So she was on board enough that she ended up, my birthday gift was new hospital scrubs. I hadn't worn them in 6 years. So I got some really nice Dickies brand hospital scrubs that I ended up not wearing yet.
Uh-huh.
Use them as pajamas maybe. And then of course I had to talk to my teenagers, and they were kind of, matter of fact, like, it's your job, Dad, is what they said. But I don't think even as mid-teenagers they really have a full knowledge or concept of possibly the risk of losing their father. It's just maybe something that they haven't seen in any of their friends. It's kind of outside their sphere. So even though they expect me as kind of a role model for my patients or for the community to be in that position, I don't think they have the experience to fully understand the severity of what could happen. So even though my girls were in favor of that, and just knowing how I am, they've lived with me, for 10, 15 years. They know I was going to work anyway, so they kind of had to say that. But I don't think at that age they would fully understand, if I was they would understand when it happened, but couldn't necessarily extrapolate that my job could kill me.
Yeah, although it sounds like they knew you well enough to know that they may as well go along with it because you were going to do it.
Right. And that's, we've really, really emphasized the obligation of your kind of path in life. And so they're on board with that, both for themselves and, for our career also.
So thank you, John. And I hope you stay in good health, particularly considering that you're probably going to be on the front lines again, and appreciate it.
All right. I really appreciate it, Saul. Thank you for allowing me to be on the podcast.
And that concludes our 2-part interview with Dr. John Scala. If you haven't heard part 1, we encourage you to go back and listen to it. And if you'd like to subscribe to On Becoming a Healer, we'd love to have you. Please join us.